I am Dr. Yatin Mehta. I'm Chairman of Critical Care and Anesthesia at Medanta the Medicity.
So what do we understand by beyond ICU care? Because we know that ICU is the best intensive care you can give to a patient.
See, if you look at the monitoring which we do in the intensive care unit, it is intensive. Not only that, the interventions are intensive. There are doctors available 24/7. There's nurses in 1-to-1 bed or 1-to-2 beds if you don't have so much of luxury. Still, the patients are very actively monitored and intervened to. Now, once they step down from there to, say, a regular ward, then most of the wards, more so in government hospitals, have less nursing care available. Not only the question of the nursing care, it's also the quality of nursing care, substantially down. So from extensive monitoring, there is almost zero monitoring once the patient goes to the ward. So basically, the doctors will see him twice a day, and that's it. Half the nurses will not even understand if the patient gets any changes or significant to escalate it to the doctors. So care, from excellent care, it comes down to very low level of care in most of the hospitals. India does not have the luxury of the ICU beds which the West has. US has about 34 per 1 lakh population, ICU beds. India has 2.3. So you can imagine, how short we are of the ICU beds, and we realized that during the COVID times. So we do not have that luxury because ICU beds are very expensive to create. Most of the patients, once they are better from the ICU care, they may not require that much of care, but they do require care. You cannot completely cut it off the umbilical cord. So that is where these sort of things come into play, where some monitoring is done of the vital signs. If you look at the vital signs which are followed in ward or emergency, which is called QSOFA, which is very basic vital signs. If anything is out of this thing, it is escalated, and the doctor knows when to shift the patient to ICU. So you don't unnecessarily utilize your intensive care resources. Also, patients should be kept safe. So if some monitoring is done, but monitoring does not cure a patient. Some action has to be taken based on the monitoring. So there has to be algorithms of when to escalate it, to whom to escalate it, and then what system is followed. So the patient has to be taken care of. If things go wrong, doctor has to be called. Doctor will call a senior doctor, either on phone or in person, and then escalate it and shift it to ICU if required. Not to shift if the ICU is not required, because you are wasting your resources. Most of the ICUs in India have 100% occupancy. Not only is a question of limitation of ICU beds, but also the question of cost. It's humongously expensive to keep the patient in ICU who doesn't need to be in the ICU. So that is where we need to have these things which should be used more often.
So what are the key challenges and opportunities we believe that there are for expanding critical care services in India?
See, it is called critical care beyond walls. That means outside the critical care, you have some sort of critical care. That also brings in remote monitoring also, remote ICU rounds. So these things we need to be utilized more than what we are doing it. We have very good digital connect. Our systems are very good and they are in place. Doctors are smart, they know how to handle the devices. So I think we should utilize this. I don't have to travel outside my place of work really to be able to go to, say, Hisar or someplace in Haryana to go and see a patient. Why? Technology is available. So you can monitor it from there. There are now remote ICUs being monitored. There are some people who are doing that. 24/7 monitoring is there. And there is an escalation alert if there is anything is required.
Thank you, sir.
Thank you.